Thank you. Okay, so this is a dog with a subcutaneous mast cell tumour. It's in an awkward location for wide resection. So we discussed the different options. The owners decided to go for a marginal resection rather than something wide and take the risk. So for well circumscribed subcutaneous mast cell tumours that have an incomplete excision, their reoccurrence rate is only 12%. So 88% will not come back. And they're considering electrochemotherapy at 2 weeks post-op at suture removal. So that's the plan for this guy. So I'm just going to go around the base of the mast cell here. And even come up a little bit on the skin here just so I can close that primarily. So again, the margins for these subcutaneous tumours are not in the skin, they're in the subcutaneous tissue. At least that's the theory that I've been working on for a couple of years now. And here we're going to go a little bit more gently just because I haven't gone around the base, I've gone more over the tumour here. So I'm going to use Metzi's to go through the skin here rather than use a cautery just to avoid penetrating the tumour capsule and compromising the resection. So you can see here I'm kind of undermining the skin, establishing our margins here and trying to lift the skin off the underlying tumour. If I think it's too adhered, then I'll go wider. Get into the accessory carpal pad territory here. I'm actually going to go wider on this, I think. Let's work it from the other way. The plane's nicer on this side, so I'm just going to go underneath it here. So just trying to go fairly wide on the subcutaneous layer. And you can see the deep layer there. So we're nicely circumscribed there. So once we get to the other side, we're going to try and sort out what's happening with the caudal aspect of this. That feels better. Finally got that plane we're looking for.
Would you like the boulder cup?
What's that?
Would you like the boulder cup?
Nope. No, it's okay. We'll just put it on the table. So now I just more or less need to peel this off, if we can. Just hold that there for me. So I might get you with that. Hold that back like so. Like it is. Mm-hmm.
This is a thyroidectomy that was having VPCs.
Yeah.
Was bradycardic and hypotensive, so we gave it isoglycopyrrolate, and now it's kind of thrown it into this, she called it trigeminy. Christy's not comfortable on making the call on if this is safe or not, and she just wanted to let you know and ask if we should get Chris's opinion.
Chris's opinion. Thank you. Bless you. Okay, there we go. Let's see if there's any. The bleeding is just coming from the deep aspect of the accessory carpal pad. I don't think that's tumour tissue, but looks a bit weird.
It's kind of tough with the like fibrous cartilaginous or the carpal pad to differentiate that between tumor.
Yeah,
It's clean.
I'll just take this as a separate biopsy just to make sure. Good. Okay, it's going to be a little bit tight, but pretty good in total. Kind of some, let's make it 3/0 monocle and 2/0 nylon, please.
I think you're narrating for the video. Is it okay if I ask questions?
Oh yeah. The video's just meant to, oh yeah, thanks. It's just meant to be the surgery environment. So ask questions, talk.
Yeah.
Don't worry about that at all.
Are you keeping these two sides like different sterility, like non-cancerous, or
We'll put them in other sides of the
with
table.
two
No,
separate towels? Any purpose?
no. That's just age of towel or whatever. It's not a deliberate thing.
Are you okay to do the closing checklist?
Yeah.
So no gauze.
Yep.
Post-op analgesic plan, we're going to discontinue our fentanyl, methadone, meloxicam, amphetamine, CRI will continue, and then be 1 hour before we go home.
Yep.
When you go to recovery, and really no special requirements.
No.
Post-op.
No.
So, post-op fluid rate, got 40 mils per field per day.
Yep.
And take care of the sharp, so double check. You just had the one sample.
2.
Okay, what's the second one? Or
The second one is just,
the margin?
yeah, kind of, yeah.
Let me know if you want me to run suture for you.
We're good.
No buildable materials.
No.
And what kind of closure you're gonna have to
Skin.
I should know that. I got the suture. And no additional comments for Jen?
For who?
No, for the surgery tech, no additional comments?
No.
Perfect, thank you.
For post-op, since you've already got it out and you don't really have to worry for other mast cell tumors, you still have to worry about the whole NSAIDs because of the H2 release or anything like that?
No. I've never worried about H2 release with
Okay.
mast cell tumours. It's a lot of unnecessary medications for mast cell tumours. So I don't use antihistamines or anything like that. So the shape of this wound is actually going to be quite nice. Didn't expect it to go this way, but it's kind of curling around the distal aspect of the accessory carpal pad quite nicely.
Would you worry if you lateralize the accessory carpal pad too much? Or keep
No,
in mind?
it doesn't really do much from a functional perspective. So we'll see what those margins come back as. And depending on those margins, we'll excuse me, see whether we recommend electrochemotherapy or not. You'll get to see that tomorrow with another similar case.
Okay.
It's a dog that had a wide mast cell tumour resection about 2 or 3 years ago and has a reoccurrence despite being completely excised. But he had a lot of problems healing after surgery. So eventually it was second intention healing, and it's now very tight. And so the owners have elected to go marginal resection, and then we'll do electrochemotherapy at the time of surgery, and then possibly again 2 weeks afterwards.
Those are mast cell tumors that had the really low rate of reoccurrence even with the incomplete margins?
Subcute do, so subcute are 12%. If you can just cut that relatively short. Yeah, no, that should be okay. For grade 2, we don't really know low grade per se, but for grade 2 mast cell tumours, cutaneous, the reoccurrence risk is 17 to 30%. That's still fairly low, and then you cut at skin level.
And you still prefer that 3-grade setting instead of the 2?
No, that's just the information that we have. So no one has looked at reoccurrence rates following resection of low grade with the Kupel system. They've just looked at it with the Patnick system. Earlier studies, and I'm not sure whether this is actually true or not, but earlier studies showed that dogs that did have recurrent mast cell tumours had a worse prognosis. So there's more emphasis on removing them completely or preventing local reoccurrence, as opposed to soft tissue sarcomas, which we're not as worried because we can always come back and get the second one.
Do you want me to catch that second tail?
No, it's okay.
I feel like I get an advantage being colored just because I get a better perspective on the surgeries.
Yeah, you're more of an exception to the rule because most people are wanting stools or that kind of thing to. This is too low for me too. Like as a surgeon, you shouldn't be hunched over like I am. So I should have actually raised this to be more like that. Because if you've got a 30 to 40 year career ahead of you, then you don't want to ruin your back.
Well, I've actually already broken my back twice just
Oh.
in sports and athletics.
How'd you do that?
Well, the sacrum was in hockey. I guess my T1, which was the most recent, was on a motorcycle.
Motorcycle?
Yeah.
Were you racing your motorbike?
I was with my sort of father-in-law. I wasn't trying to be slower than him.
Very diplomatic answers. Okay, that looks good.
All good?
All good. Just taking sharps off now. And if we can just stop the streaming, and we'll see you for the next one. The next one, if it goes, that's the one of the hard issues, is going to be a dog with bilateral thyroid masses and a caudal maxillectomy. But it's got some cardiac issues, so we'll see whether it goes or not.
Tina, you ready? Can I stop the stream?